Hi, I'm Jake. I'm an MSK physiotherapist and first contact practitioner. Just here today to talk a bit about general neck pain and give you some overall information about it and some tips we recommend here at Pure Physio. So neck pain comes from structures obviously involved in the neck. We can injure the joints in the neck, the ligaments and soft tissues around it. Quite commonly the pain is around the neck itself. So as you can see here, so this is someone facing away from you. Pain around this area in general can actually spread up into the back of the skull as well and cause headaches across the tops of the shoulders, so across this section, down between the shoulder blades. And it's also not uncommon for us patients to experience pain further down the arm. And alongside pain down the arm, you can also get pins and needles or reduced sensation. And this is something that we can see quite commonly, but it's something that we'll give you the right information about as we go forward. A lot of other problems coming from the neck is related to what we call wear and tear, and that's just general age-related changes. As we use our necks with the effect of gravity, things do start to wear and tear, and we can get changes that cause discomfort and stiffness and pain alongside this as well. So like we said, with these symptoms they can spread down the arm. This is because of the nerves that are irritated around the neck that supply this area, and it's quite common to have some morning stiffness or some stiffness overnight, and this is related to when we're in one position for too long. All those structures tend to tighten up a bit, but it's also essentially better with movement. And going on to that, we recommend painkillers to help make you more comfortable so you can keep yourself moving. Essentially the message you want to get across is motion is lotion, so keeping it moving, making sure everything's kept nice and nourished with fresh blood is really important to maintain your function also. So what we recommend is that if you're taking painkillers, whether that be over the counter or prescribed by a pharmaceutically trained professional, this will help maintain your function whilst keeping you comfortable, provided that you're sticking to the exercises and the intensity and frequency of the exercise you've been given. So like we've said, it's important to keep yourself moving, and you should be provided with some exercises, general movements just to help keep everything loose and mobile, and these are important to stick to. We do realise that these might be uncomfortable, but there's a level of pain that we recommend you keeping within, as close to the recommended parameters of your exercise prescription you've been given, provided that you're tolerant to that pain and it's not feeling like it's getting worse every time. We also recommend that you keep yourself moving with regards to your posture, so not sitting in one position for too long and letting things tighten up and seize up. We want you to keep yourself moving in small amounts so that you can keep yourself comfortable, keep everything loose and make yourself more functional. Alongside this, we can use heat or ice treatment, either or, your preference essentially, but we want to place it directly on the area with something underneath it so it's not right on the skin for up to 15 to 20 minutes, and you can then perform your exercises after this, which may make it feel a bit more comfortable, provided again that you're sticking within the bounds of the recommendations you've been given for your exercises. So essentially with the exercises, little often is a message to take away: motion is lotion. With regards to other things to look out for symptoms wise, pain that spreads down both arms is something that is not considered as common and may need further input. Pain down both legs and into the lower limbs is also something we look out for, as well as systemically feeling unwell, so you're not feeling within yourself normally, you're feeling a bit poorly, run down, feverish. There's the sort of things that we'd recommend you speaking to your doctor about. And if you want any more information from us, you can visit our website, which is www.purephysiotherapy.co.uk. And if you have any of these emergencies that you would like to get checked out, we recommend you speak to your GP or call the NHS 111 number. Thanks for your time.